Alright, so guys, a new week means a new video. I'm the MDC and MDCRX, and if you've been following up on my page, you know that this week we're going to talk about natural medicine, or as some of you might know it, naturopathy. Now again, if you've been following up on my page, you know that this week we have a special guest and we're going to be interviewing them. Before we go into the interview though, don't forget to just like this video and share it around so that different people can get this message and information. And if you have any questions by the end of the interview, just comment them down in the comment section or DM me. Alright, so now let's go straight into the interview. Alright, so as I said earlier, I have a special guest with me here today, and it's none other than Dr. Winsome Christie, naturopath and clinical pharmacist at Sunshine Pharmacy, correct?
Correct.
Do you have any other titles you want to make known to the public?
Sure. In addition to being a clinical pharmacist and a naturopath, as Mishka said, I'm also a holistic nutritionist and an integrative health and medicine specialist, and also lecturer at various universities.
Wow, you're well-rounded, as we can say. So yes, this is Dr. Christie, and yes, also my mother. I'm glad to have you here today to speak a little bit on naturopathy. So you said you were a holistic nutritionist. Just tell us a little bit about that as well.
Okay, so a holistic nutritionist is trained differently from a regular dietitian. The dietitian has more of a conventional approach. A holistic nutritionist has a more approach that's centered on complementary treatments, on herbs, foods, everything dealing with nutrition and the individual, counseling, mind-body techniques, all approaches intended to help the individual, in addition to the regular training that a dietitian receives.
Okay, so it's not just about the physical, it's more like a more all-rounded thing, so like mental, mind, and so on.
Exactly, that's correct.
Okay, well that's good. Yes, that's very interesting. So let's just jump right into the interview, as the topic says, naturopathy, natural medicine. So what is naturopathy?
Naturopathy is actually a system of medicine which involves natural treatments aimed at helping a person to achieve health, and is preventative in nature and deals with education. It uses natural medicine, natural processes like sunlight, air, heat, herbs, nutrition. Hence why I became a nutritionist trained in nutrition.
Yes.
Because I wanted to be more in depth in the nutritional aspect of an individual. So when a naturopath, you get a naturopathic visit, it can take 1 to 2 hours because it's an in-depth consultation.
And you being a holistic nutritionist, it's more all-rounded.
That's right. It helps me to be more adept in recommending diets for persons with kidney failure, persons with heart failure, persons who need to lower their cholesterol. It helps me to be more in-depth. As a naturopath, you might not have all the rounded training in nutrition, but you might be exposed to it because food and herbs can be used as medicine. Right, so the naturopath, now you have 2 different types of naturopaths based on their scope of practice. You have a traditional naturopath who does not diagnose, give injections, do invasive things like that. They do not write x-rays and order labs, tests and so on. They do not, a naturopathic physician now does even deliveries, natural births.
Oh.
So their training is similar to a medical doctor, but it's a bit more in depth because it's from the natural health approach. So all naturopaths believe in the basic thing that there's an innate healing capability that the body has.
Okay.
And once you give it the support, then it can recover from an illness. So it's not that we're curing anything, we're helping the body to heal.
Itself. Okay, that is very interesting. So moving on to our next question now. How do you think the introduction of naturopathy, or just introducing it more to persons and having more training of naturopaths out there, how do you think that would impact healthcare?
Well, healthcare as it is with conventional training is excellent. And what you have now is a body of professionals who are called integrative health and medicine specialists.
Okay.
So what is happening is these persons are trained as whether medical doctors, pharmacists like myself, nurses, and they are being trained in natural medicines. Some people refer to it as alternative medicines. But it's not really alternative because we're not using instead of, we're using it with, so it's complementary.
Okay.
And what is good about this is that it's using evidence-based medicine. When I was looking up terms to explain naturopathy to you, although I have it already because I'm writing a book, I found they were now defining naturopathy as a discipline that uses pseudoscience. Nothing proven, just old-time remedies that have no scientific base. Whereas that's not true. Naturopaths, yes, all medicine evolved from.
Exactly, because back in you have the Egyptians that would use a lot of natural medicines,
Exactly.
and it just basically changed
Has been
over course.
evolving, exactly. And you have the apothecaries from
There
where
you go.
pharmacy came, right? So therefore, yes, naturopathy would be using some old-time remedies. However, there is evidence in science now supporting the use of these things. And so integrative medicine specialists now, they are using a lot more of it, and they're actually doing a lot of research to explain how these things work. So for example, when persons do prayer and meditation, those things that we would say is more spiritual, right? They are now doing research using brain scan, MRI imaging to show the different areas of the brain that's impacted when you do meditation and prayer, to show that, for example, the parietal lobe, which deals with your spatial orientation, your awareness of the environment, when they do before and after scans on these persons who they regard as experts in meditation. So not anybody. They'd have to have this defined
Special
group.
persons.
Right. They have this defined group and they study this defined group. In this study it was Buddhist monks, and they viewed Buddhist monks and Catholic nuns as the experts who were doing meditation. And when they examined the MR scans of these persons, they found that the spatial orientation with the environment were the areas that were affected. And in fact, when they looked at the before and after scans, there was no activity in that area because of when you're deep in their meditation. They also examined prayer to see how it affected the areas. And they found the prefrontal lobes that deal with concentration and language and stuff ended up with more activity. Because you know when people pray, they're talking.
We're talking in the...
So it would be more, right. So those are scientific. Then you have persons in integrative medicine again who utilize naturopaths to help them in their practice. So it's more of a team approach. You don't try to do everything. But in my setting, I have to try and be trained in all areas because you have limited professionals to refer to. But for example, in larger areas like in the US and others, you have a naturopath who works with a medical doctor, who has a health coach, who has a nutritionist in the mix, and they just refer to each other. But they all have the same mindset. And so the cardiologist who I'm referring to, Dr. Mimi Guarneri, she's our director. She's in the fellowship of the Academy of Integrative Health and Medicine in La Jolla, California. She's a renowned cardiologist who does stents. And she has found that she's been doing all these stents, but yet still, the person still come back with heart blockages in different areas.
Just explain for them really quickly what a stent is for me.
Okay, if you have a heart block, for example, your blood vessel is blocked, so therefore you have a heart attack, and you need to open the blood vessels so that the blood can flow. They put a stent, like you said, a piece of wire then, in the blood vessel to keep it open. Right. So she would have done several stents in an individual, and then they still come back after with more blockages in other areas. So she's saying, well, what's happening here? Then she realized that you need to be looking more into what's happening in the individual. And in her research, she's found that if you do lifestyle adjustments, diet, exercise, ensuring the person has sleep, then those reduce the cardiac events. And so that's how the integrative and, well, the conventional and naturopathic or complementary come together. Because conventional medicine is excellent with acute. Mm-hmm. You have an accident, stitch the person up, do all that, right? It's excellent. It's brilliant. We've come a far way. Someone has a severe infection, antibiotics to clear it up. So conventional has its place, but when it comes to chronic illnesses,
the
long-term treatment, then you find that you go to one drug after another after another.
A lot of times just adding on drugs and so on.
That's right, and then you have end organ damage because of the same drugs that you're adding on. If you now introduce the complementary, or you would say the naturopathic approach, then the person you have to focus on the mind. We're now realizing the importance of stress in causing a lot of cardiac events, in causing a lot of illnesses. That's evidence-based. It's naturopathic medicine bringing these things out. During this COVID-19 time now, we realize that persons are having a lot of mental health issues because they're being locked up. They can't do what they want to do, and so they feel hopeless.
That's 3 years, 4 years. And mental health is, since the COVID time, we've started this entire page in the COVID period. It's just been a very big topic here because it's a very important issue now. You know, it should have been always, but it's more to the forefront now because of COVID-19, the lockdowns, quarantining, all of these.
So you end up people with terms like fatigue, COVID fatigue, because you're being reduced to going out. When you go out, you get some sun, which increases the your endorphins and vitamin D and all the happy hormones, right? Being inside, less sun, you get depressed because you're restricted. People don't like restrictions. So we now as naturopaths are recognizing, well, we did recognize before, we need to increase the social connectiveness. And that's why as a naturopath and so on, and now I'm the president of the Pharmaceutical Society of Jamaica, we are going to also be doing outreach programs twice a month to encourage people to exercise, and in doing that we'll be encouraging the social connectedness.
Because the PSJ does have a 5K initiative coming up or something?
That's great, yeah, that's correct. It's actually, we call it 5K because it's going to be the whole year. So instead of doing 5K, run one time, we're doing this whole year of activity trying to encourage persons to keep going. Even if you join and you're not exercising, just joining means you're connecting with somebody, and that will make you feel better because a lot of the time is the mind.
It is.
So as you were asking, that's a very good question actually, because of the acute nature of conventional Medicare, which has saved lots of lives, right? The integrative or naturopathic approach deals with education, preventative, gets the person involved. You see, the conventional practitioners end up under pressure, and it's like, next, 5 minutes, next, and you don't really get time to focus on the
person
involved and let them ask questions, because naturopathy too encourages the persons to be responsible for their healthcare, to participate in it, to understand what's going on and how they can change what's going on. And that way, you motivate the person
to invest more in your health.
That's right, and there's a new technique called now motivational interviewing. And that now has slipped into even pharmacy. So that when we're talking to persons, we're encouraged to ask open-ended questions.
Yes, instead of the yes and no questions. open-ended so that they can more divulge, things that will be important to their healthcare experience.
Exactly, and it will make them want to participate because you're educating the patient. The person will understand why they need to take this thing. If they don't, what's going to happen to them. And also there's a new term now, mindfulness in pharmacy. You're trying to become aware of this thing, not being judgmental of the individual in front of you. The person comes with a bag of medicine, not taking it. You're not going to say, oh, you're not taking your meds.
That's why you're sick, you're not taking it.
Right, you need to find out what's happening. The person could be actually controlled. They could have been doing other things. They could be sleeping more. It could be a falls, rise of blood pressure. It could be that they were eating up too much mangoes during the mango season and their sugar went up. and they decided that, okay, I'm going to ease off the mango, I'm going to ease off this, and then the sugar got on and they don't need to take so much pills. Because we have been encouraging them as pharmacists to test their pressure and to test their sugar. Therefore, they would know that, okay, fine, they're not taking as much. Our Jamaican populace, they're quite clever. Right, and I guess it's a Jamaican thing, they're going to juggle, as it says, right? Yes. So they will monitor themselves. However, you don't judge them, you try to find out what's happening. If they are truly non-compliant, then you try to get them compliant by talking.
And also, lots of the times you realize that patients probably might have issues with the medication and they're probably having adverse reactions like side effects, which is why they stop.
Exactly.
And then you can intervene and probably change the brand or probably ask the doctor to change to another drug in the same class or something.
Exactly. And two, after doing that, you can do your pharmacovigilance reporting as pharmacists. So
you can write about it to report just to say, all right, this drug is causing this in X patient. So basically things like that help with the company then of that drug. If they get too many complaints of different persons having that same similar thing, they could do things like call or change formulations and so on.
That's right, that's what they call post-market surveillance.
Exactly.
So what happens once the drug comes out, we the pharmacists help to monitor how it affects the persons. They won't know, the company won't know unless they get the reports. So we help with post-market surveillance, just like with the COVID vaccine that's being administered. They have to be monitoring these people carefully to say who dies, who reacts. And these reports have to be sent in
and
so they
what
can...
type of reaction.
Exactly. So that they can then say, okay, this drug is not having a good time. We need to not bother with it. Stop it right here. So pharmacists have a lot of roles to play in these things. But as we said, the integrative and naturopathy and the conventional. I'm jumping ahead to integrative. They both have a role, but when they combine and come together, then there's lots of benefits to have. You have better controlled patients. For example, the other day this lady came and the doctor referred her to me for nutrition and counseling because her blood pressure was high. And just after the one session, we realized that why her pressure was uncontrolled is because she was always worried about this daughter that had left. It was 10 years ago. After she came to terms with it, her pressure went down. During the session, I taught her some deep breathing and some mindfulness, just being quiet and being...
It's because I get to show those points, because I actually did a video, I don't know if it was last week or week before, on stress relief. And I was doing a top-down approach, so I did talk about mindfulness and deep breathing and the mantras, so like repeating a mantra like my doctor has left and so definitely help with the stress relief. So you guys can check out that video. So,
that it definitely does work. When she came in, I don't remember exactly, but her pressure was like 190 over, I believe it was 100. After we talked, and
just for reference, the normal is 130 over 80.
That's right. Yeah. Just after we spoke for like an hour, I said, let me test your pressure and see what it's like. It went down to 180 over, I believe it was 90. And after that, I said, okay, let's try some deep breathing. And we did the deep breathing for about 15 minutes. And when we tested it, it came down to 170 over 80. So therefore, and she hadn't taken any medication for the day too. So I said to her, right, so as soon as you go home, you need to take the medication and, you know, practice some more deep breathing and stuff. Because she was already eating okay. When I assessed her diet, everything was perfect, right? The only thing she was doing that was out of whack was having a lot of sodas. So we spoke to her about that, and then she comes to terms that, yes, I'm going to try. And then we say how much you're going to reduce, etc. And she's willing for that. And when I called the daughter back, her pressure was now within the normal range, 130 over 80 and lower. So to show how much mindfulness does work. There's sometimes things on your mind, and if you don't get yourself...
Mind is very powerful.
Yes.
Yeah.
And again, Dr. Guarani said, if you're eating the right food, taking your meds and everything, and even your herbs, if your mind isn't in the right place, if you're upset about something, of course she didn't use that word, she used a different word, but if you're upset about things, then the medicine's not going to work. So as naturopaths, we look at the whole person, the mind, the spiritual part of it. We encourage persons to, you know, get involved with their spiritual side, you know, and the physical. So we encourage exercise, we encourage good diet, good quality water intake, your herbs and diet, and mindfulness techniques and so on. So it's an all-encompassing approach.
Okay.
And I think conventional medicine is going towards it in some respects.
So including it more.
Yes, so including it more will make for a better healthcare system. Yes.
Okay. All right, Dr. Christie. So speaking about integrative medicine and so on, I just wanted to go on to this next question that you might have touched on some, you know, answers to it here and there in the previous question. But is there any benefit to natural medicine over conventional, or conventional over natural?
Well, I would say conventional is excellent for acute conditions.
Like I said earlier, yeah.
Like I said before, if you have a severe infection, then, you know, conventional work on it. But sometimes you can combine both together. Because, for example, I had a case where with dengue fever, the person was bleeding. They had the dengue hemorrhagic fever, and I've actually done a research on it, published it as a case study. The person was bleeding. Person was actually in dengue hemorrhagic shock. When you're in shock, your blood pressure drops uncontrollably, and the body just shuts down. In dengue hemorrhagic shock syndrome, everything's shutting down. You're bleeding from the brain, you're bleeding from the kidney, your lungs, you're having heart problems, but the heart problems don't show up at the same time. And the person also refused some conventional approaches, which in this case was blood transfusion. And because I was aware of the case, I was called in, and what I did was, because naturopathic medicine is also supportive. So the person was hospitalized, he was on drips, getting everything conventional except the blood platelet transfusion, which was one of the standards of care. So what I did as a naturopath, I supported the patient. I tried to stop the bleeding using herbs, which actually worked, and the herbs, because sometimes one herb can do several things. So the person was giving that, the bleeding stopped, the protein that was going in the urine, proteinuria, stopped, the glucose that was in the urine stopped. This was within an hour, because the nurses were doing tests frantically every hour. And before, he had proteinuria, glucose, everything negative in the urine. Within an hour of getting the herbal drink, those had stopped. He also got about probably half an hour after a 16 ounce of beetroot juice, and the platelets were really very well reduced. And by the next day, his platelets had moved from 26,000, or I think it was 19,000 to 26,000. And the doctor was pleased, said, fine, it's going up. And from then he just started to improve, still on the regular doctor's medicine in the hospital, but he was just getting his regular beetroot juice drink and the dreaded milk, cow's milk, which some persons have allergies to and so on. But surprisingly, the person only wanted cow's milk to drink. Everything else tasted bitter. And the person is alive to tell the tale. And over the period of recovery, it took him about 4 years to fully get over the dengue virus, which left him with pains in the diaphragm and other illnesses. The person actually had to do a course to get the brain working back properly because he had slowed down. And so over the 4 years, he's finally recovered. To show that natural medicines do take a while to work, however, there's a sure improvement and there's no real side effects attached to the long treatment. You just have to be persistent and stick to the goals, the diet, everything else in addition. Conventional now is much more potent medicine, works more quickly, but it may have undesirable side effects. But depending on the nature of the illness, you might have to use it. So therefore, if you combine both together, because it wasn't just natural medicines at the time that saved him, he was given supportive care in the hospital. The drips and the antibiotics. And when he came out of the hospital, he had antibiotics still, pressure medication. By that time, he was in cardiac failure, so he had the regular cardiac treatments, in addition to the herbs added on. So, but he was under doctor's care and naturopathic care. Right? So that's just to show that natural medicine is, yes, it's a collaborative approach. And that's what we need, and then everything will be fine.
Okay, all right. Well, thank you for that. All right, Dr. Christie, we just want to tell you thank you from me and the MDCRX family for being here today and just doing this interview with me, because I know how busy you are.
I thank you for asking me to be on your show, and I hope your viewers enjoyed it. I enjoyed being here too, and thank you very much. I hope you invite me again.
Of course, we can definitely work again in the future, all right?
Okay, thank you very much.